Our last presenter is present. Is he present? No. Dr. Siddhartha.
Good morning, everyone. I'm Siddhartha Rao, here to present my study on the evaluation of Timolol gel in the management of periocular pyogenic granulomas. These are benign acquired vascular lesions arising from the skin and mucosa, of which the conjunctiva is a rare site. The patient is present to us as a cosmetic blemish and with repeated episodes of bleeding from the lesion. The current management options are complete excision, which leaves a large scar, shave excision, which has a high recurrence rate. Other options include cautery, cryo, lasers, and intralesional sclerosants. Medical management is still upcoming, not commonly used, but it has been described. Beta blockers like timolol and propranolol are believed to act by inducing vasoconstriction, causing apoptosis of capillary endothelial cells and possible downregulation of VEGF and fibroblast growth factors. It is non-invasive, doesn't require anesthesia, easy to use, and has minimal adverse effects. There have been a few studies on timolol drops in periocular pyogenic granuloma, but so far none on the gel formulation. It was a prospective interventional study with a sample size of 20. These were the inclusion and exclusion criteria. The patients were assessed for eligibility, consent was taken, and baseline workup was done. The gel was applied over the lesion twice a day, and the patient was followed up at the end of 1 week, 1 month, 2 months, and 3 months. For efficacy, we looked at the maximum dimensions of the lesions, the color as a measure of vascularity, and the number of episodes of bleeding. The safety profile, we looked for the systemic side effects, that is bradycardia and hypotension, vision, IOP, and test for dry eye. We classified the response as excellent, good, fair, and poor depending on the amount of reduction. These were our results. There was a significant reduction in the dimensions of the lesion, as can be seen. 20% of the patients had complete reduction, complete disappearance of the lesion at the end of 3 months. 55% had more than 50% reduction. 20% had fair reduction, and 1% had no response. There was a significant reduction in the vascularity, as assessed by our color scale, and a reduction in the number of bleeding episodes, with almost 2 episodes per week of bleeding at presentation and 0 at the end of 2 months. Of significance, there was also a reduction in the TBUT, that is dry eye. This patient had an excellent response, complete disappearance of the lesion. These two had fair response. There was a small residual lesion, which may not be significant clinically, but according to our criteria, we could not take it as excellent. These two had fair response, more than 50% reduction in the size. This was the only patient who did not respond. She actually had increase in size of the lesion. To summarize, the mean age of presentation was 27 years. Sex was comparable. These were the various etiologies: spontaneous, post-chemical injury, post-ocular surface surgeries like buckling surgeries and pterygium surgeries, post-socket surgeries. Miscellaneous was post-supratarsal tricot for VKC. 20% had excellent response, 55% had good, 20% had fair, and 1 patient did not have response. There were no systemic side effects. There was a reduction in the TBUT, and 4 patients were noted to have papillae, although asymptomatic, and 4 patients had symptoms of dry eye, which were managed just with lubricants. To conclude, timolol gel is a safe and effective option for the treatment of periocular pyogenic granulomas, which could possibly be used in cutaneous granulomas as well, which is much more common, with no serious side effects, and can be used as a first-line treatment, especially for patients requiring general anesthesia, such as children, and sessile lesions, which are difficult to excise completely and would leave a large defect. Studies comparing timolol gel and drops, and possibly longer follow-up would be desirable. Thank you.
Thank you. Excellent presentation. Just one question. When you say you had a good outcome vis-a-vis excellent outcome means completely disappeared.
Excellent means completely disappeared.
Good means there's still some trace of the granuloma which you can see.
We had a scale, 50% reduction in size, more than 50% reduction.
It's good.
Yes.
What happens? Did you follow up these patients? Does the granuloma grow with time, or does it just remain like that in good results?
The natural history is it grows, then stabilizes. It may or may not decrease slightly. After our gel, I followed up the patient unofficially for 6 months to 1 year, but although I have not documented it. I have not seen any recurrence.
So you feel it's static, it's
Yes,
the
sir.
same size, though it does not disappear completely,
It
it
will
continues to
remain
remain partially there.
Yes, I continued the treatment for up to 6 months in some, and they continue to show a decremental size.
So for 6 months, initially, what is the time period till the lesion goes, is it?
It
How long
starts
do you-
responding in 2 to 3 weeks. It continues to respond for 3 months.
So up to 6 months, you persist with the treatment.
Yes, sir.
What was the size of the lesion, like in your study? Average size of the lesion?
Average size was approximately 10 into 10 mm.
So did you notice the like smaller lesion they responded well to topical?
The lesion size
Or
did
lesions
not
which
seem
are
to
of,
matter much.
Bigger side, they didn't respond to your therapy, Timolol therapy.
If the long-standing lesions seem to respond lesser than lesions which were presented acutely, ma'am. But the size as such, I didn't see any correlation.
And how do you explain no change in IOP?
Timolol, in normal tension glaucoma, timolol does not cause much reduction in IOP. If the IOP is raised, it causes reduction. And also, my study used a gel formulation. So maybe it is less effective than drops for reducing IOP as such. I used a hydrogel base with the timolol medicine incorporated into it.
So that other studies where drops have been used have documented a drop in IOP.
They have documented a slight reduction in IOP, but
a significant drop in IOP. I am the
you had a,
Just curious, what brand did you use, Timolol gel?
it was prepared at our pharmacy. There is no gel formulation available as such. We prepared it ourselves.
How did you prepare it in your pharmacy?
We use a HPMC base. Under sterile precautions, it was prepared. Timolol was extracted from the drops and incorporated into the gel. Basically it is to make it stick to the lesion for longer, so that it has a better absorption.
So you keep making it every week, is it?
Yes, sir.
Because it's preservative, obviously preservative free.
It is preservative free. The patients take it every week.
It's not available commercially. in
Not
general.
yet, sir.
Only my question is, you said you had to use it in patients for up to 6 months. I mean, in practice we see that a maximum of 8 weeks duration with drops is adequate for these lesions. 6 months seems too long.
The lesions which respond, majority respond within 3 months. The lesions which have some response, if you continue to use them for 6 months, they continue to reduce in size.
Thank you.
Thank you.